Hello, this is Kitty Anderson. I'm a board certified menopause coach, and today I'm going to teach you the 159 plus symptoms of menopause. Yes, that's it. That's why we hate menopause, because the hormones are important. I coach women to menopause recovery using a 15-point plan that optimizes the HRT. Our doctors just don't do this. We count and add nutrients, necessary supplements, and anti-inflammatories. Learn all about it at jumpstartaip@gmail.com.
Hi, this is Kitty Anderson. I'm a board certified menopause coach, and I started this YouTube channel to get you through your menopause recovery.
We hate menopause and its symptoms because there are over 159 symptoms.
So it wasn't easy for me. It didn't happen all in one day. It was over the course of years. I got very lucky in that I had a doctor from England in the United States who followed the International Menopause Society. And so he got me on track. He didn't provide a lot of education. I did this years later. I figured out the education piece, and that's what I'm providing to you today.
We just can't manage what we don't understand.
So this is one of a series of videos where I'm going to talk about some of my ebooks. And this one is the 159 plus symptoms of menopause. The reason this is so long, this is like 15 pages long, is that hormones kick off at least 120 functions within your body. It's in charge of all the structure of your body. It's in charge of the amount of energy you have. Everything depends upon your hormones, and HRT is going to help you resolve most of these symptoms. So really, once people see this all in one place, they're shocked that their doctor is not rushing them to HRT.
Let me just mention the best HRT.
We have identical HRT right now. The best HRT is transdermal estradiol. Usually micronized progesterone will work, but you need to add transdermal testosterone at a high enough level to get rid of symptoms.
I have a testosterone playlist for you so you can learn all about that.
So as I go through this, I'm not going to go through hormone by hormone. I'm going to just walk you through everything that's related to estradiol, progesterone, and testosterone. Inside my ebook, Your Initial HRT Appointment Guide, I do cover which hormone does what. So that'll really help you in problem solving. So I'm hoping this helps you today. You can always email me at jumpstartaip@gmail.com, and I'll send you my free ebooks. Let's go. Okay, here we are again. I am just going to walk you through a little bit of page by page of the 159 plus symptoms of menopause. And the reason it's 159 plus is I got tired of counting. I was like, oh my gosh, this list goes on forever. And yes, it does. So let's just go through this real quick. So if you can use this video to decide whether or not you want this ebook. And then from this ebook, you can also create a symptoms list that you want to share with your doctor. So that's always a part of every doctor appointment that I go to, is I always take a symptoms list, because we're not looking at blood work, we're not looking at saliva, we're not looking at urine testing, we're looking at our symptoms, and we're optimizing our symptoms. And to do that, you really need to focus on optimizing your mental health, because that's one of the last things that's going to get fixed. When you get the high enough doses, it's going to get fixed.
Please keep in mind that your starter dose is not your final dose. It takes a few months to get the final dose. Please work hard with your doctor to make sure this happens quickly.
I call these reversible and preventable menopause symptoms.
Now remember, your goal is to have a deep and beautiful sleep. That means fewer brain lesions. Brain B in this picture has brain lesions.
So the first category is physical health. Sleep. I've got like 10 different things that impact your sleep. Sleep quality, sleep continuity, whether or not you wake up at night, the number of hours you get, whether or not you're able to fall asleep, if you wake to urinate, if you wake from pain, if you wake from hunger. The amount of sleep you get affects your emotions the next day. The amount of sleep you get affects whether or not you binge eat the next day. The amount of sleep you get, of course, affects your energy. The amount of sleep you get, of course, affects your memory.
Remember that broken sleep or short sleep is associated with dementia.
You're not going to be able to consolidate memories. That happens during sleep at night. You're not going to be able to consolidate memories unless you get high quality sleep. All right, hair loss. I hear a lot about hair loss because women are very concerned about looking 10, 20 years older than they actually are. Hair loss is very difficult to reverse. You want to hop on the HRT as fast as you can. Hair loss always involves nutrition. The reason your nutrients are having trouble getting into your body is because your estradiol is low, and that opens the gates to the nutrients. So you're starving, or it's treating you like you're eating junk food all day with no nutrients. So to get the most out of your nutrition, you get your HRT and high dose estradiol. To get the most out of your HRT and the processing of that HRT, you want to get your nutrition lined up. That means very high fiber and very high nutrients, right? Because you're starving at this point.
Paleo and the autoimmune protocol have the highest level of nutrients per bite, and that gives you fitness.
Hair loss, you can have hair loss on your body. Personally, I can tell you that I was able to regrow that with a high enough dose of testosterone. That really helped. Your hair will be dry without hormones because you don't create the oils. Your hair could show problems of thyroid. And so a thyroid check 3 months after a major dose change on your HRT is really important. And sometimes screening that thyroid early on will help prevent any other issues, right? Because we need the thyroid hormone to support the entire body metabolism.
Testing thyroid is part of total menopause care.
Skin issues, all types of dermatitis, all types of rashes, all types of eczema. These are all based on your hormone level, and your skin issues will pop up when your hormones are low. So you want to get that resolved. Skin issues are also highly nutrient dependent. So you want to work on that nutrition. I have a program to help you to modify your nutrient load. Tinnitus, I'm sorry, it is tinnitus, and that's a ringing in the ears, and that can be resolved within a month or so with high dose HRT. Dry eyes can be a problem with low hormones. Watering eyes, the opposite is also true. So both of those things are true. Vision loss is a long-term problem of low hormones. You're going to see a quick degradation in your vision, and you'll see prescription changes on your glasses coming really quickly if you don't get your HRT. Nearsightedness comes with age, but also most of it can be partially prevented with HRT. Your whole body, your muscles will be really, really tight based on the loss of mostly progesterone. Honestly, that's where a lot of the relaxation comes from. You might notice shallow breathing, and when you install the HRT, you get deep breathing and you notice it in yourself and you go, oh my gosh, I'm calm again. Holy smoke, this is really fixing something, right?
Pain is not inevitable, but you might need HRT plus.
Whole body pain. All of our pain receptors are influenced by the level of estradiol and testosterone. They're both important. Testosterone will really impact your pain. It is the overriding factor, but estradiol also affects that. Drug addiction. If you have overcome a drug addiction, you're going to get triggered again. If you have overcome an eating disorder, you are going to get triggered again. This is going to kick off cravings that you never knew you had. That hormone loss will kickstart that addiction part of the brain, and it really leaves us suffering if we don't do something about it. I want you to know also that pollutants block hormones. So you want to do everything you can to get away from lots of personal cosmetics. A lot of women will switch over just to using organic coconut oil, right? They want to get away from anything that absorbs through the skin that could actually interfere with your HRT. And I consider pharmaceuticals also a level of toxins, right? Because a lot of those, 370, are interfering with your HRT. We know that your response to drugs will massively change based upon your hormone levels. So you've been taking a drug for a while, it's been working for you, you hit menopause, the hormones drop to nothing, basically nothing. And your doctor looks at you silly, not knowing, oh my gosh, we know that all these drugs work differently with low hormones. Boost those hormones back up and you'll get a better response from your drug, but also you may be able to lower your dose on any drug that you are taking, anything that you're stuck taking, this is no judgment on you. Some drugs are really necessary. There's a few drugs that are actually helpful, but a lot of them aren't. If you can change lifestyle, come for coaching. That's what we do. We get rid of drugs by doing diet and exercise. So that's what we do.
Keep in mind that coaching does not replace your doctor. I help you collaborate with them.
Weight gain depends a lot on your estradiol and testosterone levels. Progesterone is totally neutral on weight. So if you're looking to lose weight, this is how you do it.
Menopausal weight loss is a science. Look for my video on the 34 elements affecting your weight.
Let's get back to skin for a second. This will really surprise you. Acne can be low hormones. It can also be high testosterone. Age spots and not tanning anymore. That's all driven by hormones. And as you get those HRT up, you're slowing that aging process. Thinning skin is very much related to low estradiol, which means low collagen. Without the estradiol, you can't create the collagen, no matter what you eat or drink. Doesn't matter. The fine lines, you notice that topical progesterone will help that. Topical estradiol on your face will also help that. The deep frown lines, I've got these right here, right? So those frown lines, actually, if I put progesterone on there, they relax, right? We have slow wound healing without HRT. We have trouble sweating, and that's a detox agent, right? We want to sweat. We want to be able to exercise and sweat. You need the HRT. You will also find that you blister easily because that thin skin will really blister quickly, and you'll bruise easily. You'll find lots of bruising on these older people, right? Your breasts will flatten without the estrogen. They will lose the pyramid shape, right? They will not be the same breasts. And when many women add the HRT, they're so excited, the partner's excited that their breasts are back and they're perky and happy. Poor muscle tone. This is common with low hormones. So you see how flabby older people are? You can avoid that. You can actually add muscle. You can improve your posture. Your waist will thicken. Some of that is aging, but a lot of that is directed by estradiol. Estradiol will put any type of excess fat to your hips instead of to your waist. You're going to want your energy back to 100%. This is going to take HRT plus, especially if you had a COVID infection. Your energy is dramatically impacted by hormones, and I'm just going to leave it there. It's complicated, but when your hormones are at the right dose, your energy is high. You are perky, you are sassy, you are happy. That's what you're looking for. If you have an afternoon crash, this could be a sign of hormone imbalance. So you want to work on that. Exercise. You want to be able to do cardio exercise. You want to be able to have a nice high heart rate and get the benefits of cardiovascular exercise, right? So resistance, you want to do at least a mild resistance. You don't have to get into heavy weightlifting, but you definitely want, for overall health, resistance is good, and walking is a resistance exercise because you're pushing your body. Soreness after exercise will be diminished with HRT. Digestion, your stomach may no longer empty. It may sit with food for hours on end, making you incredibly uncomfortable. You can have constipation, you can have diarrhea, you can have food sensitivity, you can have lots of bloating, you can have, related to the food sensitivity, you might have sleeplessness. Related to the food sensitivities, you could have anxiety or depression. Food sensitivity can be anything, and our food sensitivities are heightened. Things that we were able to eat before menopause, we're unable to eat after menopause. So,
Women with high IQ or high performers need HRT plus because they are up to 10 times more likely to have food sensitivity.
So I have lots of videos on nutrition to help you through there because we're removing inflammatory foods. We're removing allergens. We're taking those out so that our digestion is smooth. You might have stomach pain. We notice with low testosterone, women will have something called visceral hypersensitivity, which means your entire intestines feel like they're just cranking, they're on fire, they're pain, they're cramping. It's just out of control. This happens to premenopausal women too with low testosterone. So they add testosterone back and poof, that pain sensitivity goes away. You might have reflux when you've never had that before. And if they give you one of those reflux reduction, acid reduction drugs, that's going to hurt you. You cannot digest your food with that. It's going to stop digestion. It's going to increase pathogens in your body because you need that hydrochloric acid in order to break down the food, and you need it to keep the pH of the stomach okay so that pathogens don't move all around your body. You need to stop that. You want a nice pH in your stomach. The other thing, you're going to have plaque buildup in your mouth. You're going to really notice a difference in your teeth. You're going to notice a difference in the dryness of your mouth. You're going to notice a difference in the food sticking everywhere. It's really a mess. You want to get the HRT in there, and then you'll avoid the bacterial activity that's happening. Longer term, you're going to have cracked teeth from the low estradiol. You're going to lose the minerals out of your teeth. You're going to lose teeth, so you're going to have lots of nice gaps in there. You're going to have some shifting. You're going to have shrinkage of the jaw right here. That was one of the signals when I saw my teeth misaligning down here, and I got braces, right, to fix that. Then the dentist said, that's the low estradiol that you had for 7 years. That's caused a shrinkage of your jaw. And
remember that low dosing can really hurt you. You need relatively good levels.
And that's going to cause problems in your bite, and it's going to cause problems in your breathing and all types of problems in your sleep, right? You need to have that jaw all spaced out. You need to keep the structure of your jaw. You don't want that shrinking, receding jaw. You can have all kinds of pelvic floor problems, and I luckily did not have this, but I've used testosterone since the beginning, right? So I don't have any weakness in my pelvic floor. So I never did the pelvic physio that people talk about. I never had a UTI, never, even on the low dose products. I was on low dose for 7 years. I never had a UTI. And we know that women who use HRT are 60% less likely to have a UTI. It's crazy. So you want to avoid infections. The other thing that's really weird about UTIs, women get antibiotics for that, right? And that causes certain types of dementia. It causes really emotionality related to using those antibiotics. It disrupts your entire microbiome, and most people don't have the money to go to a specialist to get that microbiome all fixed. And most people don't realize that the diet has to be really changed in order to recover from antibiotic use. This is really critical. For the lungs, you could have coughing and asthma based on your low hormones. You could have pain without exercise or pain with exercise based on low hormones. Women with low hormones have more respiratory infections. And we know all the research on COVID. I've got another video or two actually just on COVID because that's all respiratory, right? So we know that HRT is protective against COVID-19. Joints. I really see this in the 60-year-olds that come to me who have never had HRT. Their joints are a mess. They're creaking, they're crackling, they have bone on bone. They've lost all the lubrication between the joints. Arthritis is set in, and all types of degradation of the joint. And you need the testosterone to maintain the tendons, the ligaments, and the muscles. So don't think that estradiol and progesterone is enough. With that, you might be stiff upon waking, you might be stiff upon sitting. It stops you from activity, it stops you from dance, it stops you from all types of movement. In fact, they found that we get very sedentary with low estradiol. And as soon as we boost that up, we start responding to our environment in a physical way. We start to be physical people. It is really an amazing experience.
Now, swelling is complicated and needs additional treatment.
You might have some swelling, and the progesterone will help a lot with swelling. It's a diuretic.
Please remember your bone begins to degrade in just 3 years without menopausal hormones. But inflammation will also impact bone health, so make sure you do HRT plus.
The bone. So 50% of women will get osteoporosis. So that's 1 out of 2, right? That's crazy, crazy odds. Osteoporosis will land you in the hospital. You will have a fracture, you will have loss of mobility, you might end up in a nursing home, you could end up dead. This is really not funny. There's nothing funny about it. We should be doing HRT just for this. Osteoporosis starts in the 3 years around menopause. It's not something you can avoid. You have to have the estradiol, progesterone, and testosterone. They all work on the bones, all of them.
Cardiovascular disease, which kills more women than anything, will begin as soon as you have no hormones. We never stop our HRT.
So cardiovascular, the same number of women are going to have cardiovascular disease, right? The same number of women are going to have cardiovascular disease. It is just as common as osteoporosis. We're all going to get it unless we get HRT, because the HRT will stop the buildup of plaque within the arteries and veins. It will increase the elasticity of your arteries and veins. So as your blood flow increases and decreases and responds to the tissues in your body, it needs to have that flexibility. And that's all from the estradiol. It helps you avoid high blood pressure and overly low blood pressure. It'll impact all of your cardiometabolic markers. And this is your lipid panel, and it improves everything in there. You'll really notice how fast it is going to change on your annual physical. We have much lower levels of heart attacks in women who use HRT. All right, so diabetes. One of the big measures in diabetes is like fasting blood glucose and HbA1c, which is like an average of your blood glucose over 3 months. And those numbers are all lower in women who use HRT, even in diabetics who use HRT. Having diabetes does not stop you from using HRT. You should be looking for HRT to help you through this. It is going to automatically help your numbers. The vaginal area, we know that your vagina the tissue will thin out, shrink, make painful sex, right? It will not be lubricated anymore without estradiol and testosterone. They're both good. We know that sexual activity diminishes in women, and everything related to sex changes. Everything. We know that the uterus without HRT will lose its shape, it will shrink, and it will bleed. So we panic when we have bleeding on HRT, and we shouldn't, because it just means your estradiol and progesterone are out of balance. So don't panic. Just fix that balance. You'll get it. Fibromyalgia is often resolved once you have hormones at sufficient levels and you have them in balance. This doesn't need a special medication. Of course, capitalism came up with medications for fibro. You don't need it. I had fibromyalgia and I don't have it anymore. I just have HRT. All right. All of your food behaviors are affected by your estradiol level. Low estradiol drives you to eat. You will eat more frequently. You will eat a bigger meal. You will use food as a reward. You will be leaning into food like there's no tomorrow. And this is your way of fattening up, and the fat cells create a form of estrogen to compensate for the lack of estradiol, but it's not the healthy estrogen. You don't want to get fatter. Fat still has tremendous problems, right? Increases risk for every kind of disease you ever heard of. You don't want a weight problem. The weight will come off when the HRT is in. Okay, the other thing is that low estradiol leads to disordered eating. So whatever type of eating you have, whatever type of eating problem you have, add the HRT first, then pursue some mindful eating. Make sure your food is nutrient rich. I have a list of nutrient rich foods for you to lean into, because when your stomach nutrient sensors and intestinal nutrient sensors see nutrients, they say, stop eating, stop eating. You're going to get what you need. When they see high carb foods with low nutrients, it says, keep eating, keep eating. You're not getting what you need. So your body knows how to do this, right? Even anorexia and bulimia are being treated with HRT in premenopausal women. So if you have these problems popping up at menopause, hop on the HRT bandwagon, then get yourself over to cognitive behavioral therapy and a good psychologist to help you through that, right? It's a lot of behavior change.
Autoimmune flares up with low hormones. Get these put back in.
Autoimmune. So here's what happens. Hormones drop low. Your immune system gets confused because it needs the hormones in order to function well, right? It needs nutrients and hormones. You stop absorbing the nutrients because your estradiol is super low. And so your immune system starts to get confused. It usually attacks a pathogen and it starts attacking your tissues. That's called autoimmune. So you can be in an autoimmune state and have all types of allergenic type issues. You'll see those pop up. And you might not yet have an autoimmune disease. If you already have an autoimmune disease, you're going to get another, and you're going to have severe organ damage at menopause without HRT. Hands down, there's no argument. We know this. All the different types of autoimmune disease do well with HRT. Mental health. This is a long list, and I'll try to go quick. You've heard this in other videos, but HRT resolves anxiety, panic attacks, depression, repetitive purchases, repetitive cleaning, OCD-like behaviors, antisocial, irritability, just withdrawing socially, being fearful goes away with HRT. La, 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 la. I can't stress this enough. How many times I have a client come into me and they're afraid of HRT. The fear comes from low hormones. Yes, everyone's afraid of HRT. I mean, our society is so busy selling us other stuff, right? Because nobody gets rich. If you use a generic drug, nobody gets rich. So you're not going to get an ad for HRT. Your doctor's not going to talk to you. You're not going to get an ad for HRT. Your doctor's not going to talk to you about HRT. It's not going to happen. Other issues, relationship issues. You might be suddenly dismissive. Oh, they don't really matter. You know, you're dismissing everybody, right? You start to have relationship problems, might end up in counseling. You might not feel a boost when you go to talk therapy when you have felt a boost before. It may be reigniting previous trauma. So something that you conquered in a decade before could suddenly pop up. You might have lost communication skills. Our verbal skills are tightly tied to our hormone levels. You might be feeling unimportant, pushed aside. And yes, your kids are leaving home and it is harder and they're getting independent. But still, there's an illogical feeling of unimportance and dissociation from society, a difference. You feel othered. You don't feel integrated into society. It's really a problem of low hormones. You might feel a loss of autonomy, a loss of a feeling that you can do this. You might feel a loss of control or a loss of motivation. You might feel alone in a condition where you wouldn't have felt alone a decade ago. You might be watching your friends also have low hormones and you see them withdraw and you don't realize we're all withdrawing. So we're losing all that social interaction. You might struggle to be friendly. You might notice this about you, that once upon a time, someone would say, gosh, she's really friendly, she's great, and she's so open and easy to talk to. Suddenly, you don't have those skills anymore. You don't have those abilities. The low hormones took it away. You could feel a loss of maternal behavior, so you don't feel like mothering. You could feel a loss of sexuality, a loss of gender, a loss of femininity. And I'm using that very broadly. I don't mean to kind of go against your sexual identity. This is not personal at all. This is just that these hormones help us feel a certain way, right? So you might have a lot less joy in your life. And with this long list, you can see why, right? You might have the life adventure problem where all of your goals are related to your husband's adventures, not to yours. You don't have your own life. You don't have your own adventures. You're kind of stepping back. You might be feeling, I don't want to be a problem. I don't want to really make a fuss. I don't really want to do that. I don't really want to go out in front. I really don't want to be that visible. I don't want to be that seen. Those are all signs of low hormones. You need help. You might feel really out of sync with your partner. This is really hard. You might feel very self-centered. You might feel very, very self-centered. You might feel fragile, right? You might have mood swings. You might have mood swings. You might even have a bipolar diagnosis because you've been able to manage it through exercise and diet, and hormone levels were supportive, but once they've dropped, then suddenly you're into turning on genes for bipolar, genes for schizophrenia. All these things depend upon your hormone levels. It's a switch, right? It gets turned on when hormones drop. You might physically be more sedentary. Noises can get really problematic. Your perceptions are really changing, and noises might start to really bother you, the noise in an area. Your focus is lost entirely. You need high estradiol and high testosterone to manage that. You might have difficulty multitasking. One thing you used to be really good at was really based on hormones. So get those hormones back, you'll be back in action. You might be obviously really disorganized, right? You might look around your environment and say, this is really crazy. I don't appreciate myself. It's so disorganized. You might have lost confidence in others. And this is really a tentative time for your children, maybe a tentative time for your husband who might be going through something. So you want to get yourself back in action so that you can provide the support that you've always been able to provide. Here's another one that's really amazing is the empathy problems. We know that women with low hormones can't recognize emotion in the faces of others. So they have low empathy. That we know that the mirror neurons where empathy lives inside of our brain are fueled by estradiol. So we have low empathy. Our entire world needs compassion right now. We got some big problems to solve, and we have to have this HRT to save our world. I really believe that. This is a strong statement, but I can't imagine living without it, because with it, I'm able to coach women from illness to health. That's massive. That means I have to live in their life. I have to have so much empathy that I can step into their life and understand what's important. You might be more tearful. You might notice yourself laughing less, which is really sad. Music, you might not respond to music anymore. You might find yourself listening to less and less music. You might find yourself not moving to the music, right? You're not moving anymore. That's the lack of hormones. You could be gorging or binging. You could be overeating. You could find yourself doing emotional eating that you've never done before. You could find yourself mindlessly eating. All of these things are related to low hormones, and you can make them go away. Your appetite, actually your satiety, which is a hormone that says, I'm full, that depends on estradiol. You cannot feel full without estradiol. So don't even try. Get the HRT. All right, sexual health. Attraction. Do you respond to someone who's not wearing clothes? Do you turn your head? Do you respond? Do you have interest? That's what they call it. So you need to have interest. You have to have interest in visually connecting. You have to have interest in emotionally connecting. You have to have interest in a physical connection, a touch. Do you reach out to your husband anymore? Do you reach out to your partner, whoever that may be? Do you reach out to your kid? Are you touching the people around you? Are you connecting? That's hormones. Desire is the ability to sustain interest, right? So interest is just kind of turn of the head type of touch, but sustaining interest means you can get all the way through foreplay and the actual act of sex, if that's what your end point is. I don't know what your end point is. Can you climax by yourself? Can you climax with a partner? This is also a really good way to tell if you have enough testosterone, if you can actually have an orgasm. Then you're at the right dose.
Low hormones cause brain damage.
Cognitive health. This is huge. So, word finding is the number one issue that women have. They can't remember names anymore. They can't think of a word. They're trying to use words and they're losing their vocabulary. They can't find the word that they need that's appropriate for the situation. This comes back with HRT. You don't have to live like this. Memory planning. Critical thinking. How logical are you? Are you able to think through a problem? Are you able to gather all the inputs that you need to actually solve a problem? Or are you jumping? Are you impulsive? Are you jumping to conclusion?
These type of things lead to bad decisions.
Movement planning. Can you move a complicated movement? Do you notice yourself simplifying your movements? That's low hormones. Working memory, that's the short-term memory, being able to read a phone number and then dial it up, right? The whole 11 digits or 7 digits or whatever. So you're not saying, what did they just say? What just happened there? All that kind of stuff, right? Spatial memory, like maps, being able to read a map, go to a new city, drive around, not get lost. Right? Speed of thought related to testosterone. This makes you want to go get it right away because you used to be so quick. Well, you had 3 times the amount of testosterone going. Calculation, being able to calculate a tip, being able to figure out when some number is way off, right? Just having that intuition with calculation. Organization, so that's just, once again, how you're organized inside your mind, that feeling of organization. Identification, being able to identify things, places, all this type of stuff. Emotions, being able to identify emotions is related to your hormone level. I've talked in other videos about brain health, so I'm not going to hit you hard here, but your whole brain structure will change within the 3 years around menopause if you do not get HRT. Please go get HRT. If you're having hot flashes, the structure of your brain is changing. They've connected those two things, and dementia is on its way. So let's stop that. We'll get the HRT, and that'll help us get the nutrition in place because we will have controls on our drive for food. We'll be able to start educating ourselves on the nutrition needed in menopause. This is all something that you can overcome. So that's it for the 159 plus. It is a lot. It is a lot, and I'm sorry this is happening, and I'm sorry that the world is not preparing you. I feel like they should tell you as a teen that you're going to go through reverse puberty, but you're going to lose 120 functions. If you don't get it, you're going to scrape along the bottom of life, and you've got to get identical HRT, and we have that. And I probably spend about $60 a month. If I pay cash, I use a Good RX coupon, and it provides me with all of this health. I get all these things all returned, all recovered because of this. I've had different levels of HRT support, and I've seen in the last 2 years, and you can look at my videos for Wild and Wonderful Recovery. If it says Wild and Wonderful on it, it's the story of the last 2 years as I went to very high levels of HRT, and I saw all of these things change. So I've lived it. It's important. It's important to me. It's critical to me. I will never live without HRT, and I don't want you to be afraid of it. So if you are still concerned, email me for this ebook. I'm happy to share it. I want you to be better. I want wellness for you. All right. jumpstartaip@gmail.com. Take care.
Once again, if you'd like to build your own personal plan for menopause recovery, email jumpstartaip@gmail.com, and we work it out in coaching. This is a 3-month contract where I work for you exclusively. Please share. Let's help our sisters. Thank you.